Recently, there have been changes to the recommendations at which ages we start colon cancer screening. So for a long time, it had been 50 years old, but because of these increased risks in people under the age of 50, about 2 years ago, we had a change in our recommendations where we went to screening those 45 and over on a regular basis. So depending on the type of screening test, this can be done once a year, once every 3 years, or sometimes just once every 10 years if people have colonoscopies done. But we've changed that dramatically to try and address the fact that there's this increased risk of colorectal cancer in people under the age of 50.
Family history of colon cancer is a big deal when it comes to screening. We know that people who have a family history of colon cancer, particularly in a first-degree relative, like a sibling or parent or a child, their rate of colon cancer could be up to about 4 times as high as the general population. That is probably even higher in people who have a family member who had colon cancer at a younger age, less than 50 years old. So the screening recommendation is either start screening at 40 years old if you have a family history of colon cancer, and that's a first-degree relative or multiple second-degree relatives. You start screening at 40 years old or 10 years earlier than the youngest diagnosis in your family. So if you had a father who was diagnosed with colon cancer at 35, then you should start screening at 25.
It also, for those increased risk populations, unfortunately, the stool-based tests are not as effective and not indicated for those populations. So we really need to go to just doing colonoscopies for those people who are at increased risk.
One thing that I sort of touched on just about my personal history, but there's a subset of patients who have a genetic risk for colon cancer. There's various criteria as to when you might consider that and when you want to recommend genetic testing for those patients. If they have any family member with colon cancer at a very young age, usually less than 40, they're going to qualify to get that done. There's a set of criteria called the modified Bethesda criteria that sort of are guidelines as to who should qualify for this genetic testing. But keep that in mind, and as genetic testing is becoming more and more common, I think we're just finding people with these mutations just because they've done the genetic testing. And then you need to know that, because recommendations for those patients are to start screening at 20 years old and to do it annually. And so that really high-risk population definitely needs to be on your radar.